My project is on eye movement desensitization and reprocessing therapy, also known as EMDR. EMDR can help people with post-traumatic stress disorder, or PTSD. What is PTSD? PTSD is a mental health disorder that occurs after a person experiences or witnesses a traumatic life event. According to our textbook, it can become a chronic problem. It can last decades and even in some cases, a lifetime. Some events that may cause PTSD are as follows: witnessing homicide or suicide, traffic accidents, combat, natural disasters, sexual assault, victimization, for example, sexual molestation, robbery, and aggravated assault, survivors of the Holocaust, and life events like domestic violence or diagnosis of HIV. Symptoms of PTSD: re-experiencing the event, spontaneous memories of the event, reoccurring dreams having to do with the event, flashbacks, intense or prolonged physiological distress, and marked physiological reactions. Avoidance: may experience distressing memories, thoughts, or feelings. Avoid external reminders of the event that may cause distressing memories, thoughts, or feelings. Negative thoughts and mood or feelings: not able to remember parts of the event, negative thoughts about oneself, others, and the world, feelings that may come from a sense of blame, ongoing negative emotions of fear, horror, anger, guilt, or shame, feeling detached from others and not being able to experience positive emotions, heightened arousal, aggressive or angry outbursts, reckless or self-destructive behavior, hypervigilance, easily startled, and problems sleeping or concentrating. What is EMDR and what is its purpose? EMDR is a psychotherapy method which helps people recover from trauma and other life distressing experiences. EMDR therapy is different from other therapies. It is different because rather than changing the emotions, thoughts, or behaviors resulting from the distressing issue, it instead lets the brain resume the natural healing process. Another way it is different from other psychotherapies is that for many clients, EMDR can be completed in fewer sessions. Its purpose is to resolve unprocessed traumatic memories in the brain. The 8 phases of EMDR. Phase 1 is history and treatment planning. In this phase, the therapist will go over the patient's history and see where they are in the treatment process. The therapist will also talk about their trauma and try to identify what specific memories need to be treated. Phase 2 is preparation. In this phase, the therapist will teach the patient many different ways to deal with the emotional and stressful things they may be experiencing. Phase 3 is assessment. In this phase, the therapist will determine what specific memories that will be targeted, as well as other associated components such as physical sensations that are stimulated when you think about an event for each memory. Phases 4 through 7 are treatment. They will use EMDR techniques to treat the targeted memories. They will ask the patient to focus on a negative thought, memory, or image. The therapist will ask the patient to do specific eye movements and other taps or movements mixed in. It all depends on their case. After that, the therapist will ask the patient to let their mind go blank and notice the thoughts and feelings they are experiencing. When the patient identifies these thoughts, the therapist will then have the patient refocus on the memory or move on to the next memory. If the patient becomes distressed, the therapist will bring them back to the present. Over time, distress from those specific thoughts, memories, and images will fade. Phase 8 is evaluation. In this phase, the therapist and patient will evaluate the patient's progress after the sessions. How effective is EMDR? Independent and controlled studies show that EMDR is an effective way to treat PTSD. In 2012, a study was conducted with 22 people. The study showed that EMDR helped 77% of those who had PTSD and psychotic disorder. Their hallucinations, delusions, anxiety, and depressive symptoms were significantly improved after treatment. Their symptoms also didn't become worse. Another study has proven that EMDR is more effective than typical prolonged exposure therapy when treating symptoms. EMDR also maintains its effectiveness even after treatment ends. Potential problems with EMDR. The problems with EMDR are minimal when done under the guidance of a licensed practitioner. Things that may occur are as follows: emotional distress, insomnia, nightmares, anxiety, and short-term depression. Unpleasant dreams relating to the memory they are trying to process tend to subside as treatment goes on. These side effects may occur during or shortly after a session. The patient must be made aware of these risks beforehand and consult with their therapist before going through with treatment. And these are my resources.